Well, welcome everyone to back to Morning Coffee on RVN Television, Cherry Hill, New Jersey. And this is a great segment we're always doing. This is the Workcred Expert Series section, which is coming on once a month with us. And we have two great people here
Yeah,
to
Joe,
talk
this is
about
going to be
it.
a great segment.
Real important thing. We have Karen Elsie, and she's the Associate Executive Director of Workcred. Karen, welcome again. And we have Patricia Tanabe, who's the Executive Director of the American Society of Clinical Pathology, correct? And listen, ladies, welcome to the to Morning Coffee. This is very important, especially because of the fact that with COVID and everything, clinical testing is so important. So, so Pat, tell us a little bit about your organization and how it certifies people to be clinically test people in safety.
Thank you for having me.
Mm-hmm.
Yes, my society, American Society for Clinical Pathology, and I'm the executive director of the board of certification. And the society has over 100,000 members, both pathologists and laboratory professionals. What I do is I certify the laboratory professionals, and to date we probably have over almost 600,000 people certified around the world. Wow. We certify those people that work in the clinical laboratories. Many of you are familiar with them. They could be the phlebotomist that draws your blood, or you go in, you have some blood work done for testing, and it's the personnel that works in the laboratory doing that testing. Especially now with COVID, spotlight has been brought to the clinical labs, and we are the personnel that you want to make sure are doing your lab testing, because we've been educated and trained to do such things. And it's been a very interesting time the last couple of years with getting brand new testing, mostly in molecular. COVID testing is molecular testing, and the need for qualified personnel to do that testing.
Oh, that's interesting. Karen, are there research, or does the certification last a year, 2 years, 3 years? How often do you have to recert?
You have to recertify every 3 years.
Okay.
So once certified, it's time limited, and in 3 years' time, you're going to have to what we call recertify, and that's by doing continuing education and fulfilling certain requirements like that.
Interesting.
Wow.
Pat, can you talk a little bit about what's the education required to become a medical laboratory technician, and what's the difference between a medical laboratory technician and a medical laboratory scientist?
Very good question. There is difference in education, and actually there's another level that's phlebotomist. I'll go from a phlebotomist is someone that has a high school graduation degree, and then they do some training. It could be 6 weeks, semester of training, and they can become a phlebotomist, take their certification, become a phlebotomist. Medical laboratory technician is an associate degree program. With again, these programs are that's a 2-year program. 1 year is spent in clinical internship, and the medical laboratory scientist, of which I'm one, is a bachelor degree program. And again, there is 3 years of didactic undergrad, and then I spent a full year doing a clinical rotation to learn and gain experience in the laboratory.
You know what's so interesting about this whole thing of certification is everybody's really concerned about safety, because I know that a lot of people are they're afraid about needles, etc. But the biggest thing is the public want to be assured that when they come in for any kind of test, that the tests are going to be accurate, they're going to be they're safe, etc. So it's so important for you to come on, Pat, and tell people that it is safe, especially during the COVID thing, because COVID scared everybody.
It did, yeah.
And I think I want you to address that, because address the safety issue.
It is, and actually our mission statement is that we're doing this on behalf of the safety and health of patients worldwide. To have validated, verified testing is so important. It's like when people talk about computer, programs, garbage. You put garbage into the computer, you're going to get garbage out. The same thing has to do with testing. Not that, if the blood sample you took or the sample, there's something wrong with the sample, you're not going to get accurate results. And that's where, a certified individual like myself and the hundreds of thousands of others that have been trained and certified comes into play, is that you have to know that that specimen is valid before you even start testing it. And then you go through the tests that, make sure that the testing is done properly and then reported properly. I mean, there's 3 phases to testing. It's that what we call pre-analytic. It's the getting the sample, the correct sample, the right sample, the analytic, which is doing the testing, and the post-analytic, which is getting it reported to the proper individuals and doing it all safely. Protecting, our number one, mission here is to protect the patient, to give valid test results. But at the same time, you have to protect yourself, that you don't stick yourself with a needle, you don't expose yourself to diseases. So it's 2 ways.
Absolutely. That's important.
You made a good point there, that it's not only the patient, but it's also the provider too that's also has to be safe.
Yeah.
And Karen, what I love about Workcred is you're always bringing people to the table for us on morning coffee that are so significant in this society right now where we live in, because everything is based on safety and certifications and alternate of careers for people too. So I really thank you for doing this. This is great.
Yeah.
Pat, tell us a little bit how you got into this. How did you get involved with the organization?
I always loved sciences and math, and I actually had a high school guidance counselor. Everybody knows about nurses and everyone knows about becoming a doctor, and kind of said, there's this other kind of profession out there. And it was, at the time, we called ourselves medical technologists, medical technology. And I sort of said, all the same coursework as pre-med or pre-dent or pre-vet, as well as doing this. So I got into it, went to a school that had that as a major, and all of it actually is great training for medicine in general, because it's such a diverse training in the laboratory. And unfortunately, in the world of medicine today, I had a concentrated study, a year doing laboratory testing training, whereas unfortunately physicians, there's just too much to learn and they spend literally no time in the laboratory, which is unfortunate. But there is too much to know. And so we are the experts in doing that. And I love the field because it's like solving some kind of logic puzzle. You have the mystery or the question of what is wrong with this patient, and the testing that I do solves that mystery or helps, solve that problem. Many people quote, there is a quote that's out there that 70% of the diagnosis for diseases are made through laboratory testing. Without the laboratory testing, you cannot know what the disease is, whether it's a blood test or a biopsy, where somebody is looking under a microscope. Different personnel, like cytotechnologists, are those personnel that are doing the pap smears and looking at cancer, biopsy tissue.
Yeah.
So there is a whole nother side, but it's still the same lab profession that, they do a wide range of testing.
Accuracy really is important. Yeah, it's important, the accuracy.
Well, that is exactly pinpointed what you're talking about, because accuracy is everything when it comes to testing.
That's right.
You have to make sure that those tests are accurate, and I feel safe. When I go to labs, I feel perfectly safe because of people like yourself, who are really kind of the watchdog of the industry. And what I also like about this is that this is another case of somebody that can get in the medical field and that's interested in science and stuff, and doesn't have maybe the time or the resources to go to medical school.
Yeah.
And so that's a great alternative at the certification process. Tell us about the certification process.
For our certification process involves 3 things, and that is you have to have a certain requisite education and training. You have to, so you have to prove to us that there is this education through a transcript or whatever, to tell whatever the minimum is. It could be high school, it could be associate degree, it could be bachelor's degree, or more. It could be postgrad. And also the appropriate training. Now, you could get that in your program. There are majors. You can major in, as I said, medical laboratory science. It's called a variety of things, but we're calling it medical laboratory science, in cytotechnology, in histology. There are different things you can concentrate on. But if you don't do that and you have, let's say you end up with a biology degree, in a bachelor's degree or an associate's degree, And then you fall into a laboratory position, and now you want recognition. Through experience, you can also apply to the exam. So there is the experience component, and third and not least important is passing the certification exam. But you have to have all three. You have to have the minimum requisite education, you have to have the experience, and you have to, pass the exam. And then you can become certified.
Wow, that's interesting. That can lead to a lot of other opportunities also, Joe, within that profession. The growth.
There is.
Lots of growth.
Career ladder there is especially, we see a lot of phlebotomists that start out or to be a medical laboratory assistant, same amount high school degree with training or experience. Then you could step it up, you get your associate degree, you could become a medical laboratory technician, and then further on, bachelor's degree. And there are steps above that as well. We have a whole series of what we call specialist certifications in discipline specific, like a specialist in blood bank, which is a really important specialty that employers seek to be a supervisor of what is called a blood bank or a transfusion service. It is it's a very difficult certification, but these are people that are running transfusion services in the country, or they're at Red Cross, or they're at a blood bank overseeing those operations to get, vital blood products and donations of blood that is so vitally needed. Especially during COVID, we've been facing a shortage of blood donations, and that is so important, especially someone with sickle cell anemia that's their treatment. And we've been having a very difficult time. So blood donations are always needed, especially during a crisis like this.
Yeah. And there's probably I'm sure there's safety measures in place to make sure that blood is valid for use.
Right.
Yeah.
Absolutely.
Wow.
Pat and Karen, it's always such a pleasure to have you on the show and educating and informing our viewers that they can stay safe. And also, not only that, but the flip of that coin, showing people great alternative educational paths that can lead to a great and promising and fulfilling career. So I always thank you, Karen, for bringing people on like Pat. And Pat, I'd like you to just tell the viewers where they could reach you and who should call you if they have any questions or comments, or even on the industry itself.
Yes.
Absolutely. We have a website. It's ascp.org that you can, public can go on to and find out a lot. But more importantly, you're looking for the Board of Certification, and there is a whole section on the Board of Certification. We have a Facebook presence, so that people often do ask questions, and they can also go around the website, look at the various certifications we offer, and they would be able to, maybe look into it a little bit to see if this is something they'd be interested in or they qualify for. And we have some nice tools on there that can ask you a series of yes and no questions to see if you might be eligible for one of our exams.
Karen, is there anything else you'd like to add for us?
No, I just wanted to say, thank you for Pat for joining the conversation today. And we're really excited to be able to share with your audience the different types of certifications that are available, especially now as people are looking to transition to new careers and new fields. And Pat and the ASCP Board of Certification have a variety of certifications that people might be interested in, and we encourage them to go to their website and take a look.
Absolutely.
Ladies, thanks again for joining us, and it's always a pleasure. Pat, I'm really excited about the American Society of Clinical Pathology because that keeps people like me safe, which I really care about.
Yes,
so,
we do.
I really appreciate that.
Thank you. It was great information.
Yeah, thanks so much, ladies, and we will be back in a few minutes.
Thank you.